So you've probably heard that vitamin D is important for bone health, and that's true. But what if I told you vitamin D is one of the most powerful regulators of your immune system, your brain function, your hormones, and even your risk for chronic disease? I'm Dr. David Haase, and today we're diving into why vitamin D is one of the most misunderstood and underappreciated nutrients in medicine, and why simply taking a supplement might not be enough. So vitamin D isn't just a vitamin, it's actually a pro-hormone. That means it acts like a hormone in your body. It influences hundreds of genes and biological pathways that impact your overall health. Virtually every organ and tissue in your body has vitamin D receptors, meaning that vitamin D plays a direct role in your immune system regulation. It helps you fight infections while also reducing autoimmune activity. It's important in brain and mood support. Low vitamin D levels are linked to depression, cognitive decline, ADHD, and Alzheimer's disease. It's important in cardiovascular health because it helps regulate blood pressure and inflammation inside the arteries. It's important for hormonal balance of all types. Vitamin D influences testosterone, estrogen, and insulin sensitivity. For cancer, research suggests that maintaining optimal vitamin D levels may lower the risk of certain cancers. In short, vitamin D is a master regulator of health. So why do so many people have dangerously low levels? One of the most overlooked of vitamin D is its impact on brain function, mental clarity, and long-term cognitive health. Studies have shown that people with low vitamin D levels are more likely to experience depression, anxiety, and brain fog. But the effects go even deeper. Deficiency in vitamin D is also linked to an increased risk of neurodegenerative diseases like Alzheimer's and Parkinson's. Vitamin D affects the brain in many different ways. First of all, it's influential in the regulation of neurotransmitters. Vitamin D influences serotonin and dopamine, which impact mood, motivation, your ability to learn, and emotional resilience. Vitamin D reduces brain inflammation. Chronic inflammation is a driver of brain aging and cognitive decline, and vitamin D plays a key role in calming this process. Vitamin D supports neuroplasticity. Your brain's ability to form new connections and repair itself is connected to your vitamin D levels. Vitamin D boosts blood flow to the brain. It helps to regulate vascular function, ensuring your brain gets the oxygen and the nutrients it needs to function optimally. If you've been struggling with mental fatigue, difficulty focusing, mood swings, checking your vitamin D levels should be a priority. Despite its importance, vitamin D deficiency is one of the most overlooked and common health issues worldwide. So what are the main reasons? Well, a lot of us are living in fluorescent caves. We live and work inside, and therefore we don't get enough sun exposure. Our bodies make vitamin D when our skin is exposed to sunlight. But with these modern indoor lifestyles, sunscreen use and living at higher latitudes, most people don't make nearly enough. People with darker skin tones also have a harder time producing vitamin D. Melanin, which is the tint inside the skin, blocks UVB absorption, meaning individuals with darker skin may need significantly more sun exposure to produce adequate vitamin D. Aging reduces our ability to synthesize vitamin D. As we age, our skin produces less vitamin D from sunlight with the same amount of exposure, making supplementation more critical. The gut and the liver impact absorption. So vitamin D is a fat-soluble nutrient. So when you take it as a supplement, individuals with digestive issues, liver dysfunction, or poor fat absorption may struggle to utilize it properly. And what's the result? Up to 50% of the population is deficient in vitamin D, and most don't know it. So if you go to your conventional doctor and they check your vitamin D levels, that's awesome. You have so much information in your hands, and congratulate your physician for taking good care of you. There are two tests that involve vitamin D. One is 25-hydroxyvitamin D, which is the inactive storage form, which does give us an idea about how much raw material is there. But to more deeply understand how well your body is utilizing vitamin D, it's useful to sometimes check the 1,25 dihydroxy vitamin D. That is the active form of vitamin D. Because some people will have a normal 25 hydroxy vitamin D, but still experience vitamin deficiency symptoms due to poor conversion into its active form. This is especially true in people with chronic inflammation or kidney disease or magnesium deficiency. Your laboratory evaluation should be customized to your particular needs. So, how much vitamin D do you really need? Well, you've probably heard that 30 nanograms per milliliter is a cutoff for vitamin D deficiency. But optimal levels for immune function, brain health, and disease prevention are closer to 50 to 80 nanograms per milliliter. And here's the kicker. The standard RDA for vitamin D is just too low. 600 to 800 international units per day that most guidelines recommend is enough to prevent rickets, which is the advanced vitamin D deficiency disease that causes your bones to get thin, but it's not necessarily enough to optimize health. Most adults need to take at least 2,000 to 5,000 international units daily to maintain optimal levels, and some may require even more based on their genetics, weight, or health conditions. The only way to know for sure is to test. There is a lot of individual variability here. And there's another thing most people don't recognize. Taking vitamin D alone isn't enough and isn't optimal. It's very important, if you're taking vitamin D, I believe, to also take vitamin K2. There's several different forms of K2, and it works with vitamin D to ensure that the calcium that vitamin D is utilizing goes into your bones, not your arteries. Without enough vitamin K2, too much vitamin D can contribute to arterial calcification. Magnesium is needed to activate vitamin D. If you're deficient in magnesium, your body can't properly use the vitamin D you're taking. And other cofactors such as zinc and boron also support some of the vitamin D metabolism and immune function. So if you're supplementing with vitamin D but not getting results, be thinking about these critical cofactors. At Maxwell Clinic, we take a personalized systems medicine approach to optimizing vitamin D levels. That means testing, not guessing. We check your 25 hydroxy vitamin D, and if indicated, your 125 hydroxy vitamin D levels, plus key factors like magnesium and vitamin K2. We customize your dose. One size does not fit all. If you have to take supplementation for your vitamin D optimization, it should be customized and tracked. If your vitamin D levels are low, we also want to explore why. Is it gut health, inflammation, nutrient deficiencies, or frankly lifestyle, that you're not spending enough time in the sun, getting vitamin sun? And we also want to ensure that there's proper absorption. We focus on your whole body health to make sure your body can actually use the vitamin D that it is able to receive. So if you've been feeling fatigued, struggling with immune issues, cognitive challenges, or you just want to optimize your health, vitamin D could be a very important missing piece for you. But simply taking a supplement isn't enough. You need to know the right dose, the right cofactors, and a functional medicine approach can really make a difference here. At Maxwell Clinic, we go beyond simply treating symptoms. We really work hard to uncover the root causes of nutrient imbalances and create personalized strategies to restore your body's natural ability to heal. If you're ready to take charge of your health, schedule a free information call with our team. We'd love to help you explore what becoming a patient at Maxwell Clinic looks like and how we can support your journey to optimal wellness. Be Maxwell.